then also lastly there's dribbling, and then incomplete bladder emptying. All this due to the enlargement of the prostate, constricting the urethra. It actually also pushes the bladder a bit, and you know the bladder is full of nerves, and that's what gives you all those sensations. You have some urgency or some sensation to wee, even though you just gone and came. So all these will render the man's life, or the quality of the man's life, quite low. And then if you don't take care, this constriction will end up being complete, so that in the end the wee is blocked. There's an acute urinary blockage. Please move on. Yes. So I just brought this picture just to relate to the fact that there are a number of tests for men to do after 40. So as healthcare professionals, when they appear in your consulting rooms, you need to advise them. Men aged 40 plus must check their PSA, prostate specific antigen. And then the prostate specific antigen, when you check, based on the number or the value, you need to run it against the person's age and even race for you to come to a proper conclusion. If there are issues, they need to further go and do other tests like the digital rectal examination, there's ultrasound, there's biopsy. So there are a number of tests that you need to go through for you to fully diagnose. See them early. The earlier you can detect, the better the chances of the patient surviving. So don't just treat for BPH, but try to run these tests as well, so that if there's cancer, it can be caught earlier and then treatment given. And then also just to indicate that the PSA is affected by a number of things. So you can see that if you just had a recent digital rectal examination, PSA levels will go up. So you just don't do one determination and then conclude. If there's recent ejaculation, so we advise patients not to have done any sex between 24 to 48 hours before taking the PSA test. Even bicycle riding, long-term bicycle riding, sort of anything that irritates the prostate, per the anatomy I showed over there, will cause the PSA to rise. So you need to eliminate all these things before you can determine what value the person has that has an issue. So there are a number of things you can do. For instance, somebody already having an enlarged prostate will be subject to certain symptoms like waking up several times a week in the night. So such people, we don't advise them to take a lot of water in the evening, but at least 2 liters of water must be taken throughout the day, and then it should be less getting to the evening. Reduce alcohol levels, caffeine and all that. So these are non-pharma advice to give to the patient. Then there's the treatment options. There's the 5-alpha reductase inhibitors, there's also tamsulosin and others. But then our focus now, for which I'm standing here, is on the special nutrition, the herbals, and particularly I want to talk about saw palmetto. Saw palmetto is a widely researched herb, and NS Chemist in collaboration with STADA has brought in a product that is called Prostinal. Yes. So Prostinal is a herbal supplement to help resolve the symptoms of BPH, benign prostatic hyperplasia. So STADA is also known for Zoflora and then Nizoral, just to indicate the company I'm coming from. Yeah, so we have Prostinal. Prostinal is a herbal supplement. We have it in 3 variants. We have the Prostinal Control, we have the Prostinal Forte, and then Prostinal Night. Please move on. So Prostinal Forte. Prostinal Forte mainly contains saw palmetto, nettle and zinc. Saw palmetto, nettle and zinc. And then one important factor to note is that the amount of saw palmetto is 320 milligram, which is the researched therapeutic dose. There could be a lot on the market with saw palmetto, but then it's not up to 320. Of course, based on the assessment, you can do higher doses, but the minimum therapeutic dose for saw palmetto is 320 milligram, and it is in postinal. So there's also postinal control. In fact, let me just sum them up. The postinal forte and postinal control and night, they have the same amount of saw palmetto, 320 milligram, to help the prostate health. But then the control, we've added an additional herb, which is called Tribulus terrestris. Tribulus terrestris, please go back to the control, yes. Or go forward rather, I think. Then I'll come back. Yeah. So Tribulus terrestris helps with libido and erectile function. Again, the research is showing that men developing an enlargement of the prostate for some reason lose libido and erectile function, especially libido. So this particular one has been boosted with some amount of Tribulus terrestris to help improve libido and erectile function. It also has a number of vitamins, including vitamin B6, to help release energy from metabolism. And then night, please go back. And then postinal night. Postinal night also contains the same amount of saw palmetto, 320 milligram, but then it also has an additional herb called ashwagandha. So ashwagandha is known to relieve patients of stress and help them have a good night's sleep. So here we are talking about the patient who already has the symptoms of the BPH, especially nocturia. This patient will wake up several times a week in the night and then will end up having a low quality of life in the morning. So why not add something that when he still wakes up anyway to wee-wee, which problem the saw palmetto is solving, he can still come back and have a good night's sleep. And that is the ashwagandha in the postinal night. Yes, please move on to almost the last. Yes, so just the last one. Yeah. So again, it's from NS Chemist, and then we've introduced it with, if I should say, a perfect price. So the night and then the control are going for 98 Ghana cedis. It has 30 tablets. And then the fourth is going for 89 Ghana cedis. 89 Ghana cedis. One of the frequently asked questions is, so a patient, you've assessed the patient, or patients even want to ask you, they want something that will help them sleep better. And at the same time, they want something for that boosts libido. Which of them should you give, or should you give all together? No. It has 320 milligrams saw palmetto, and that's what we are treating with, especially with the BPH. So if a patient is on night, the patient should be on night. Or you can switch to control or forte, but you don't combine them. Yes. I'll leave it here for Lawrence to just add one or two, and then we can end here for something from Exeter.
Thank you. So we also have another product called Immunosen to boost the immune system of your patients. Every patient that is coming to the ward, we always say that the person needs an Immunosen. In the present day that we are trying to use less antibiotics so that the patient does not become resistant to antibiotics, we are introducing what we call Immunosen. Immunosen have got 5 powerful antioxidants. We have the vitamin D3, known as the cholecalciferol, that is very helpful in the build-up of what? Immune cells. That help in what? Phytosis that fight against antibacterials. We also have beta-carotene that help to generate more immune to produce antimicrobial in the system to fight antimicrobial infections. So every patient that comes from your hospital, you are treating the person, or that person walk out of the hospital, we are saying that person need an immune system booster. That is what? The Immunosen that we're having. It comes in 30 capsules. It's a soft gel, 1 daily for 30 days. And then we encourage you to write it for your patient. Thank you so much. If there are any questions, we are waiting for any question that we can answer.
Please, any questions?
Any questions, please? Okay. Hello. Please, the Prostar, the night and this thing, which I didn't get it well. Which one do you start the person with?
Okay, thank you. So you're asking about the night or all the three. Okay, so the basic thing is that they all contain saw palmetto, and the product is actually to target BPH or to treat BPH. Sorry, to manage BPH, not to treat. Yeah. So it all has the same ability to manage your BPH patients. But then if you have a patient that you think the patient might need an additional help concerning libido boost or erectile function boost, then you can go for the control. If you have a patient who already has the BPH and then especially having nocturia, so the person actually can't sleep, he needs to wake up several times a week, give the person night, because in effect we are actually helping to shrink. What I didn't add is that with all the research, saw palmetto is mimicking the action of the 5-alpha reductase inhibitors, see, like finasteride. So it is actually preventing the progression of the enlargement of the prostate, at the same time going ahead to even shrink it. Yes, so that's what all the three are doing. But whilst they are at it, you want to just give something else to help improve the patient's quality of life. So these two have an additional sort of herbs that just help the patient. Otherwise, any of them for BPH can be used. You can even have a younger patient, if I say younger, just 40 plus, between 40 45, who says, because of my work, I'm able to have a good night's sleep. At the same time, I want something for my prostate health. Then you can still go for the night. But even the night, you are saying that you should be taking around 6 a.m. Sorry, 6 p.m. Because you also don't want to take so much water close to your bedtime. I hope it's clear.
Okay, follow up. I've gotten the answer I want, but go ahead and clarify. I'm a man, of course, have a prostate. I'm here to be diagnosed as having BPH. Can I take any of those products as a way of prevention?
Okay, thank you. So as I said earlier, it's a herbal supplement. So what we encourage, of course, these are over the counter also. So just like we've been doing, you can just take something if you are 40 plus, because the research is showing that it's men after 40 that will start developing an enlargement to the prostate, leading to symptoms. Of course, there could be a few outliers, but then as I said, the first sign of an enlarged prostate is actually a weak urine stream. It's a weak urine stream, so you can start from there. If you don't have all that, then I want to ask you to advise the patient or let the patient test for PSA, for instance, before you can start. But if the patient is already expressing or showing you, reporting signs or symptoms of an enlarged prostate, then you can go ahead and give. While the patient is on it, the patient can test for the PSA, because again, we are still trying to target prostate cancer as well. So whilst you're on it, you better also test your PSA, so that if there are any issues, it can be unearthed and then further treatment done. I hope I'm clear.
I have a conclusion.
Okay. So in conclusion,
thank you.
Prostinal has come to.
Thank you. I'm Justin from St. Francis Xavier. I want to find out about the possible side effects. My first question, and second question is the distribution. Is it only pharmacies, private pharmacies, or you have plans to supply hospitals?
Okay, thank you. So the major possible side effect that we can talk about is saw palmetto is widely researched, and then the major thing is that it thins blood. So candidates for surgery and co will be advised not to be on this for at least 2 weeks to a month before going on the surgery. And it can actually be combined, like I said, you can combine this with tamsulosin and it will be okay. The other advice we usually give as pharmacists is that with the herbs, you want to separate them from your allopathic drugs. So if you are doing Prostinal in the morning, or sorry, you are doing the tamsulosins in the morning, you just separate them. Maybe do afternoon for the herbals. And for distribution, I think that is my conclusion. NS Chemist is scattered all over Ghana. Everywhere in Ghana, there's an NS Chemist wholesale that you can find. Even in Ho, we have a wholesale. So it is widely distributed through NS Chemist wholesales to various pharmacies and then health facilities. And also we are outside here. Any further questions, we'll be able to address it for you. I don't know whether my colleague wants to add anything. I think you forgot one, just 1 minute, yes.
So we have this hematonic, that's iron polymatose with vitamin C. So that's what you can look at it. You can come to our stand and then we can talk more on that. Thank you so much for your time.
Oh, you can do it better for them. Do it better. Do it better. We now take a presentation from Tobinco. That will be done by Farm Frederick Owusu-Mensah. But I have a question for all of us. General Secretary said I should ask. The one who will give the answer will be rewarded with 50 Ghana, but General Secretary is not here. So when he comes, I will ask the question for him. Okay. I'll come up. Yes, thank you very much. All right. Good afternoon. My name is Frederick Owusu-Mensah. I know that some of us are tired. Some of us are also, dozing off. I promise you that I'll very quick. I'll make the presentation interesting. So what I'm going to do is, I'll keep the interesting part at the last part of my presentation. All right. Okay, I was talking about Neomine Plus syrup. We have the tablets now, we have the syrup. I'll talk about the syrup. And then I'll talk about challenges in the management of infectious vaginitis. And then I'll also mention some products from Tobinco Pharmaceuticals. I'll just mention them briefly in passing. So I'll start with the other products. The first one is Frumax Gel. This is chlorhexidine digluconate, 7.1%. And this is to be applied on the stamp, umbilical cord stamp of a baby. So that's our chlorhexidine. Now we are no longer using methylated spirits. So the medication now is chlorhexidine digluconate, 7.1%. And ours is the Frumax Gel. The next one is myconazole cream. We have myconazole nitrate 2%. This one is for fungal infections. We have our zinc oxide cream, 15% for nappy rash. You see, I'm being fast. We have myzine cream. That one is a combination of myconazole plus zinc oxide, which is used for nappy rash and fungal infections. All right, so coming back to my main thing, Neomine Plus syrup. Neomine Plus syrup is a multivitamin and it contains vitamin B1, B3, B6, B12 with L-glutamic acid. So what's so unique about Neomine Plus syrup? The first thing is that it contains high potency of B vitamins and it comes in a liquid formulation for oral use. It also contains L-glutamic acid. And then, as usual, the product is affordable and then the quality cannot be denied. What do we use Neomine Plus syrup for? It's being used in sickle cell patients, and with Neomine Plus, because of the L-glutamic acid, it helps reduce oxidative stress in sickle cell patients, thereby reducing sickle cell crisis. So that is one function of Neuromin Plus syrup. Another one is that because it contains other B vitamins, it helps to reduce endothelial damage. So that's also another function here in sickle cell patients. And then malnutrition. Rebecca said, so malnutrition. And studies have shown that 45% of children who died, 45% of children under 5 dies from malnutrition. 45% of children in low income and middle income countries, 45% of children died from malnutrition. And then it's also useful when it comes to brain development. Neuromin Plus syrup is useful when it comes to brain development. We have the B vitamins, B1, B6, B12, which helps together for brain development. We have L-glutamic acid, which converts to neurotransmitters. That also helps transmitting information from one part of the body to another. So that's also a function here. And then in summary, Neuromin Plus is useful when it comes to sickle cell